Good morning, and welcome to the Shatkin F.I.R.S.T Monday Morning Minute.
Good morning, I'm Dr. Todd Shatkin, and welcome to this Monday Morning Minute. Today I want to talk to you about the Cube. It's a brand new product that I'm using in my office to help for extraction of difficult teeth. And you can use it for a number of other things. It's a piezotome, and I have to say, Dr. Ronald Petrosky introduced me to this unit. He kept being very adamant. He bought it and he said, you got to use this, you got to try it, and Shatkin F.I.R.S.T should sell this product. Ronald Petrosky, thank you for introducing me to this product. He's one of our mini dental implant centers in New Jersey, and you're right. I have to admit, you are absolutely right. This is a fantastic machine. When you have a difficult time with a root that's broken off at the gum line, or you have a Ankylos tooth and it's hard to get out, this system works fantastic. And what we're doing is, when you buy our Cube, we're including the extraction instrumentation with it. There's a number of different kits you can buy. We're focusing on extractions, but there's a lot of different things you can use this for. And what I want to show you is how easy it is to use. You'll notice on the front of the Cube that there's D1, D2, D3, D4. And you know from my lectures, we talk about this quite a bit, the different types of bone density patients may have. So if you're working in D1 bone, which is typically the lower anterior mandible, you can use the setting D1. If you're in the posterior mandible, it's usually D2, and the maxilla would be D3 or D4. And those are the different settings and the different strength of cutting of the bone. The way it works, it's very easy. You take this little instrument, and there's a number of different shapes and sizes of these instruments with different angles on them. But this is a standard one. You just take that instrument and turn it on you screw it on, and you use this little wrench to just tighten it on there, like that. And you just tighten it. And then you're ready to go. And then there's a foot pedal. And it has a water dispenser as well. And you just go ahead and take that instrument, and right around the periodontal ligament, all the way around the tooth, you just go until it goes down about 4 or 5 millimeters and go to the next spot. It'll take you about a minute or two. Be patient with it. Just work your way around it. And then you'll just take your elevator, and that root will just pop right out of the bone. What's great about this is it's very atraumatic. You're not going to remove bone like you would with a drill if you had to cut around the bone. All you're doing is sliding this down the PDL and just loosening those fibers until the root just kind of pops right out. So I really love this product. If you do a lot of extractions in your office, which you should be doing if you're doing mini implants, you're going to want to get this product. And I recommend getting another cart, just like you have for your Aseptico Shatkin F.I.R.S.T motor. Get another cart from us, put it on there, set it all up the way you want. You can put your Anura buffered injection system on the cart with it if you want, like I do, and then you'll have everything you need in one place. So again, this Piezotome Cube, manufactured by Acteon and labeled for Shatkin F.I.R.S.T, is a must if you're doing extractions in your practice. I look forward to seeing you on the next Monday Morning Minute, and thanks for joining me.
Hi, I'm Fitz, and welcome again to the Monday Morning Minute. Our final course of the year will be our Advanced Mini and Mono Dental Implant course, and it's going to be on the 16th, 17th, and 18th of November. On the 16th and 17th, we'll be lecturing on mini dental implants and monos. We'll also be talking a little bit about problem solving on some difficult cases. And on Saturday, November 18th, you have an optional day with Dr. Samuel Shatkin. He'll be training dentists on how to place Botox. You can have live patients here and work right on live patients, or you can choose to do the didactic portion. Completely up to you. We hope to see you up in Buffalo here at one of our courses, and we hope you have a wonderful week placing our minimally invasive implants. See you next week on the Monday Morning Minute.